Dr. Raymond Churyai. I am a physician working at the Kericho County Referral Hospital in Kericho County. It's a government facility, a referral for the county, and I also do some part-time private practice within the town. Yes, I was offered postgraduate diploma in gastroenterology through the University of South Wales, sponsored by Merck Foundation, which I did between September of 2021 and August of 2022. That's when I completed my postgraduate diploma in gastroenterology. And I was lucky after that to be sponsored again by Merck Foundation to go on into the MSc program, which I just completed 2 weeks ago. To begin with, online learning, well, it was my first experience doing an online course, and therefore, of course, initially it was a bit challenging learning the system, learning to use the learner system, and getting used to that kind of training. But in the end, after a few weeks, I was able to get used to the learning platform. I was able to use all the materials and the resources that were offered through the platform. And the good thing about the online learning was that I was able to continue with my work, my regular work at the county hospital and the private practice. I needed to dedicate a few hours in a day, usually 2 to 3 hours in a day, to do mostly the academic writing for the courses, for the modules that were given. And therefore, the learning module was good. We were able to interact with my fellow colleagues and the tutors. The tutors were also very helpful in terms of guiding us through the courses, and we had an active student support teams that were also helpful in guiding us how to use the module, how to access and use the library, and therefore most of the things actually went on smoothly. During the course of the program and after that, at least I've been able to acquire a lot of knowledge in the management of gastrointestinal diseases. And these are diseases that involve the digestive system. We talk about from the esophagus, the stomach, the small intestines, the large intestines, and there are those associated organs with digestion also, the spleen, the pancreas and the liver. So we were exposed to all these content through the program. At the moment, I can say I am a better clinician in terms of managing and discussing gastrointestinal diseases. I am able to discuss well with gastroenterologists and share knowledge. I'm also better at training doctors who are under me, medical officer interns. I also have medical officers who are under my department. So I have more knowledge now to train them. And also it has offered me a better care to the patients with gastrointestinal diseases. I'm able to diagnose most of them very much more easily than before. Even though the course was mostly online and therefore no hands-on experiences, I've been able, through the knowledge from the course, to read about procedures, and I've been able to apply that then to doing procedures like gastroscopy, upper endoscopy, to manage diseases of the gastrointestinal system. So I can say that has impacted on how I treat patients and how I discuss patients with my colleagues and how I train and teach doctors and interns who are in my department and rely on me for their knowledge. I work under the county system, and therefore I have a better knowledge then of advising even the county in terms of what we may need as a county hospital to manage gastrointestinal diseases. And top among this list is we've put a request through the county to equip the hospital with an endoscopy machine, because an endoscopy machine will help us to diagnose and treat upper gastrointestinal diseases. We are also able to diagnose cancers of the gastrointestinal system, which is quite prevalent in my region, which is the South Rift region of Kenya, where there is a lot of cancer of the esophagus, cancer of the stomach, And like the most of the country also, we have quite a number of cases of cancer of the colon. With an endoscopy machine that we've put a request through the hospital and the county, we will be able to diagnose most of those conditions early, and therefore give patients a better chance to survival if we diagnose them early. So that has impacted in such a manner. I'm also able to see patients also outside the county referral hospital with gastrointestinal diseases. So that has brought care of gastrointestinal diseases near the patients. We don't have physician gastroenterologists at the moment within the county, and therefore most of them are now relying on me to treat their conditions and manage them. And there are few, some of which we still able to refer accordingly depending on their conditions. With the experience of the course, that it is purely online, and it gives you room to continue your practice and you're able to continue with the learning, I could highly recommend this course to my colleagues, for whom I've already recommended others. There are some of my colleagues within the county interested in other courses like preventative cardiology and others. So I would really recommend this for my colleagues because of the nature of the training and the intensity of the engagement and the reading that is involved in this course. It really brings out what we need to learn per module in each of these courses. I would really like to thank the Merck Foundation for this course. I was able to get a communication for the Merck Foundation sponsorship through Kenya Association of Physicians, which was shared in the group, and I applied, and I was able to get the approval to study the course. So I truly appreciate the Merck Foundation for sponsoring me, not only in the postgraduate program, but they were gracious enough to sponsor me into the next level of Master of Science in Gastroenterology, which I just completed. So I'm really thankful for the Merck Foundation for that, and the way also some of my colleagues we've discussed, and they've been very supportive and in training doctors to get fellowships. Some of these fellowships are out of reach for most of us in the country. Most of them still require us to go outside the country. But these programs have been helpful to help us prosper our knowledge and our subspecialization without interrupting our family lives, without interrupting our work activities, and we are still able to continue working for the employer, which is most of the time would be the county hospitals and the county as a whole.